The director of the COVID-19 Early Treatment Fund, Steve Kirsch, has actually put out a challenge. He said anybody who wants to sit down and just have a conversation or a debate on early treatment and vaccine and safety and efficacy, he'll pay them $2 million. And do you know, not a single individual has come forward to even have a debate or a discussion. Who wouldn't want $2 million? He's offered $1 million to anyone who can point out anything that the National Institutes of Health, the CDC, and the FDA has done correctly in pandemic response, just to make the case. Who wouldn't write a few paragraphs to get $1 million? So I can tell you, the individuals who are on, I guess, some other side of this issue are fearful. They're fearful of their own position. I think they're regretful, I think they're uncertain, and they clearly don't want to come forward in any type of fair discussion. So the forms of censorship that we're seeing and things going on behind the scenes are very much a manifestation of cowardice.
Speaking of fear, patients, top on the list, right? Especially older, grandparents and just older people who are, no, I'm going to run to take this vaccine, and no, they don't even know about alternative treatments because they don't hear that. You don't hear that on the news. They don't see it. Facebook, they're not on Facebook. What is your message to that population? They're in fear, and a lot of them, doctor, are believers. We're Christians. We're not supposed to be fearful this way.
As we sit here today, 80% of Americans over age 65 have taken the vaccine. And why wouldn't they? Most of them took the vaccine in December, January, February, March. When the vaccines came out of the clinical trials, they had 90% efficacy. They looked okay. The story on the safety problems with the vaccines, that took time to evolve. Most of the seniors had already taken their vaccine by that time. And sadly, the number of people who died after the vaccine is heavily biased in the older age groups. In fact, those are the ones, sadly, who died after the vaccine. So our seniors were preyed upon by the virus itself and the deadly nature of the virus in the elderly, but also they're the ones who suffered the fatal consequences of the vaccine as well. So the seniors have seen it on both sides, but the 80% who've taken the vaccine, that means 20% have either had the illness or they really can't take the vaccine from an elderly perspective. I think that population has basically served out its intent and desires in terms of wanting to be protected from COVID-19. The sad thing now, through the first week of August 10th, Center for Medicare and Medicaid Services tells us of individuals over age 65 in the hospital with COVID-19, 60% are vaccinated.